The way I found out Meghan had CF was we were at our local hospital, and after a couple days there, they said, "You're going to Dartmouth, Chad, stat." And I was a lot scared. And we got up here. They took her in the PICU. They evaluated her. They came to me and said, "We're not 100% sure. We think we know, but we need to prepare you for she may not make it through the night."
I was very concerned. I had a lot of confidence in our PICU team, and once she was diagnosed with cystic fibrosis, we knew what we were dealing with and we could make her better.
CF, which is the way we abbreviate cystic fibrosis, is a disease that affects the lungs and the digestive system primarily.
Well, CF is thought of as traditionally as a lung disease. It certainly has a lot of effects on the GI tract as well.
It's a genetically inherited disease. However, the parents, the carrier state, is asymptomatic. So parents may not know that they're transmitting this disease to their children unless they've been tested specifically for it.
My earliest memories of knowing that I had CF would be when I was about 3 or 4, when I would always be in and out of the hospital all the time.
The worst parts of the disease are the malabsorption, the inability to absorb nutrients from the gastrointestinal system, and the thick, sticky mucus that forms in the lungs and sets up the lungs for infection and for chronic cough and respiratory illness.
We have a multidisciplinary team of people that was set up by the CF Foundation many, many years ago. So we have doctors and nurses and social workers and nutritionists.
They could see 5 or 6 people in one visit, but we're all there in the clinic at the same time. And the care is individualized and tailored to what each patient needs.
The CF team is amazing. And when I say team, it's a true team. They all work together. They communicate to each other, and there's a big team.
Day-to-day life with CF is very difficult. I'd wake up, do an hour of lung therapy treatment in the morning, go to school, take pills every time I ate something, drank something.
They have to do an amazing amount of work to keep themselves healthy.
She's, come through this beautifully and really is working with the team and really taking responsibility for her care now.
As she has grown through adolescence, she has taken on greater responsibility for her self-care. And she has matured into a young lady who is setting a course for maintaining health through her adult life.
So there's been many advances in CF care, from us discovering the gene that causes it to now coming up with drugs that actually correct the defect in the chloride channel.
Recently I had the opportunity to start this new CF pill called Orkambi, and this pill is life-changing.
This treatment targets the specific gene change that Meghan has and really gets to the basic cellular problem of cystic fibrosis.
One of the amazing things I've noticed about Orkambi is I can take a deep breath in. Ready? I've never been able to do that before.
It's amazing, as a person who's worked with CF for 30 plus years, to realize that we're finally at the threshold of the kind of treatment that will change this disease.
Meghan, we love you, and we think that you have the opportunity for a beautiful and wonderful adult life, and we are behind you all the way.
Well, I'd like to congratulate Meghan on how beautifully she has grown up into such a beautiful young lady. And I look forward to continuing to work with her because I work with the adult CF program as well. So I'm not going to be that far away.
Take care of yourself. Remember that your mother has tried to take care of you all her life, and she's a good person. Support each other and have a great life and a long one.
All the things that Chad is, you've taken on, and you're going to continue down the road in whichever field you take. And I know that there's going to be tons of people that are going to benefit from you and what you've learned.
One thing I imagine for myself in the future would be to graduate with a criminal justice degree, do something in my major, and also become an inspirational speaker. I would love to travel and inspire people everywhere and just tell my story.